Hi, I'm Monica. I'm your nurse today. We're going to be doing the head-to-toe assessment. First, I'm going to be asking you about the general survey, and I'm going to start with the level of consciousness. So can you please state your first name?
Silver.
And where are you right now?
The communications building in the classroom.
Yes. What time of day are you here?
Evening.
Okay. And who's the president?
Obama.
Yes. So, or in oriented times 4. Now I'm going to be checking for your mood and affect. You seem to be at ease, calm, appropriate for the setting. Then I'm going to be looking for your posture and your position, and you seem to be erect and holding yourself up with no accessory muscles. And your hands are in your lap. Okay, and then going on to your your hygiene. And I don't smell any distinct odors. And you're well kept. And your makeup looks great today. And then your age. Can you please state your age?
24.
Okay, very good. And your nutritional status.
I would say moderately healthy. I try to eat healthy overall, but sometimes I slip.
Okay.
Your phone's weak.
Yeah, I understand that. Okay, next I'm going to be checking your vital signs. And that is your temperature, blood pressure, pulse, and respirations. And for temperature, generally around like 98.6 degrees Fahrenheit. Pulse would be around like 62, and respirations 12, blood pressure 120/80 in that general area. Can you please state your height and weight?
I am 5'2", and I'm 130 pounds.
Okay, and your BMI, which we already checked up earlier, and you're 24. 25 is generally overweight, and 30 is obese. Just so you know that. And then we're going to be looking at your head and your face. So looking at your skull contour, you're rounded, and you're firm, okay? And looking at the symmetry of your eyes and your nasal and your mouth and your eyebrows are all symmetrical. And then I'm going to be feeling your axillary here and your frontal sinuses. Any tenderness?
No.
No?
No.
Okay, so no tenderness noted there. Then I'm going to be looking for your TMJ. So I'm going to be placing my fingers right here and open and close. Any pain?
No.
So no pain with TMJ noted. Then I'm going to be looking at your CN5 and 7. So can you squint your eyes for me? And raise your eyebrows. Smile. Bare teeth. And puff cheeks. Pop. Good. So CN5 and 7 intact. Then going to be looking at your lymph nodes. Okay, so your pre and post auricular lymph nodes are right here. Any swelling? Tenderness?
No.
Okay, I don't feel any swelling. Okay, and then I'm going to be looking at your supraclavicular lymph nodes. Any tenderness here?
No.
No? No swelling. Your submandibular lymph nodes here. Any tenderness?
No.
No? Okay, and your submental tenderness?
No.
No swelling noted. And your cervical chain nodes right here. Tenderness?
No.
No? No tenderness noted. Okay, very good. Next, we're going to be moving on to your eyes. And I'm going to be looking at your pupils and to see if they are equal and round, which they are, and if they're reactive to light. Very good. Okay, and I see it constricts with light. That's good. And I'm going to be looking at your conjunctiva, which is right here. Moist and pink. And then your 6 cardinal signs for the CN 3, 4, and 6. So just follow my finger. so CN 3, 4, and 6 are intact. Now I'm going to be doing your ears and looking at the placement of your ears. And so I would have to say they are bilaterally symmetrical on your face. Then I'm going to palpate the pinna and the tragus. And yours is pierced right here. Okay, so they're firm and intact. Then I'm going to have the otoscope, and it's going to be upside down, and I'm going to pull your ear, your pinna back and up. And so have my pinky like this, hold it upside down, up and back, and look inside of it. And to see if you have any exudate or the tympanic membrane, which is going to be a pearly gray color. Okay, and next after your ears, I'm going to go on to your nose, and I'm going to see your nasals are symmetrical. Okay, and your mucosa is moist. And for patency, can you hold one side and breathe out the other? Okay, very good. And then I'm going to be looking at your septum to see if it's deviated. Okay, so your septum is not deviated. And your turbinates, which are the ridges in your nose, and that is when you breathe in, those moisten and warm up the air so it's not so harsh and cold and dry on the back of your throat. Okay, so those are a darker pink color. Now moving on to your mouth. So can you open up your mouth for me, looking at the mucosa? So you are pink and moist. Very good. And stick out your tongue for me. Very good. Midline, okay. And your teeth, smile. They are white and straight. And let me see your ear overbite. Okay, very good. So your top teeth go over your bottom teeth, which is good. And then I'm going to be looking at your uvula in the back. Okay, it's intact and dangling, and your pharynx in your back. There you go, thank you. Very good, which is moist and pink as well. And then looking at your CN10, which with your tongue depressor, I will put on your tongue and make you say the ah noise, ah, and that is where your soft palate is going to rise and your uvula will shake, which is generally good. And then your gag reflex, which we won't do here, only in a clinical setting. I won't gag you right now. Okay. Okay, so after the mouth, I'm going to be moving on to your neck, and we can't do this right here, but generally you would be at a 45-degree angle. So just to show a little bit, just go back just a little bit. Okay, so I'd be looking right here to see if any distension or any abnormalities right here, and I don't see anything, so no JVD noted. Then I would be looking at the carotid and feeling it right here and here. And you don't want to do them at the same time because you don't want to pass out. But they're bilaterally symmetrical on, I would say, 2+. If I was listening to them with my stethoscope, I would say no bruise noted. Okay, and then after that, I'm going to palpate your trachea. Any tenderness here?
No.
No? Okay. And I would say it is midline. Very good. And after that, I'm going to check your CN11. So can you shrug your shoulders for me? Very good. And your range of motion for your neck, which is, can you look at this way? This way? Up and down. Now, ear to one side, ear to the other side. So you have full range of motion with that. That's good. Okay, so now after the neck, I'm going to be moving on to your heart, and the 5 heart sounds I'm going to be listening for are your rate and rhythm, your S1 and S2 together, S1 and S2 separately, extra sounds, and a murmur. And your 5 placements, I'm not going to put my ears in because I want to be able to talk to you. So you have your A, P, E, T, and M. With your aortic placement right here, that's going to be your second intercostal space with the right sternal border. Your pulmonic is your second intercostal space, the left sternal border. Erb's point is your third intercostal space, left sternal border. Your tricuspid is your fourth or fifth intercostal space, your left sternal border. And your mitral right here is your fifth intercostal space, your left midclavicular line. Okay? So done with your heart sounds. Now I'm going to be moving on to your lungs. So do you mind turning around for me?
Sure.
Okay, and I'm going to be doing the thoracic cage expansion. So I'm going to put my hands here. Can you breathe for me? Deep breath. Very good. One more time. Very good. And I just want to see that they do expand. So your lungs are bilaterally symmetrical. Next, since you're turned around, I'm going to do the 18 placements on your back. So I'm 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, and 18. And the reason why I curve up at the ends is because you have a shorter torso, and so I don't want to get too low down here because I want to hear just your lung sounds. Okay, can you turn around for me? And I'm going to be doing your anterior sounds. And there's 10 in the front. So 1, 2, 3, 4, 5, 6, 7, and 8, 9, and 10. Okay, and after that, I'm going to be looking at your right, which you have 3. So I'm going to come over here, lift your arm if you're okay with that, and listen for your 1, 2, and 3. Your 2 is more in the front because that one is in between the 2 here, so it's kind of pushed towards the front, and the third one's towards the back. And your left only has 2 spots, so the placement for that, lift your arm if you're okay. 1 and 2. And if I was really listening with my stethoscope, I would note any adventitious sounds, such as wheezing, stridor, rhonchi, or rails, which are all not very good. Okay, so moving on, we're going to go to the abdomen. So if you don't mind laying down for me. Okay, and I'm going to bring your shirt up real fast. Okay, so the general contour of the abdomen is relatively flat, okay? Then I'm going to be listening for the aortic pulsations, and generally for a thinner patient, they're going to be stronger. So we'll see right here. And you have faint aortic pulsations. Next, we're going to be listening for any bowel sounds, and you're going to start in your right lower quadrant, then move on to your right upper quadrant, left upper, and left lower, going around. And if I didn't hear any sounds, I would do 5 minutes in each quadrant just to see if I could hear anything. And if I didn't, then I would be a little more worried about that. And then I'm going to palpate, okay? Any pressure?
No.
Okay. Good. So you're soft, which is good, and you're not firm. Okay, so you can sit back up for me. All right, and now looking at your lower extremities of your legs and feet. Okay, I'm going to be looking at your hair here, and you are shaved. Edema, you have no swelling. Capillary refill, I'm going to squeeze, and you immediately return, which is very good. Okay, then I'm going to ask you to, I'm going to palpate your heel to see if you have any tenderness here?
No.
No? This one?
Nope.
No? Okay. Feel them together. Very good. Okay, so your dorsalis pedis pulse right here. Bilaterally symmetrical, 2+. And your posterior tibial pulse right here. And they're bilaterally symmetrical as well, 2+. And now I want you to dorsiflex up and plantar flexion down. Very good. Now range of motion. I want you to stand up. And can you bend your knees like this? Very good. Okay, you always pop when you do that. Okay. And now with your ankles, can you go inversion, eversion, and then dorsiflex, plantar flex. Next one, inversion, eversion, dorsiflex, plantar flex. Very good. Now I'm going to look at the symmetry of your hips and your knees and your ankles together, and they are bilaterally symmetrical, which is very good. Okay? You can be seated now. Okay, and after that, let me think a little bit. I think I might have gotten out of order. Let's see. I didn't do the upper extremities. Okay, so hold on, let me think for a second. Yeah, upper extremities. Okay, sorry, looking at your nails. I can't remember this one. They're rounded and pink, and they're not cyanotic, which is very good, no blue. Okay, and your radial pulses, bilaterally symmetrical. Turgor retracts immediately. Oh no, I did do this because you did C and 11 with your shrugging shoulders. So I mean, we'll do it anyway if I forgot. So C and 11, can you shrug your shoulders? Okay, very good. So C and 11 is intact. And then range of motion for your arms. So can you go out, up, and flex? Okay, good. So full range of motion for your arms. And I'm going to look at the symmetry of your shoulder and your wrists and your fingers. And they seem to be symmetrical, bilaterally symmetrical to me. Okay, very good. And then for grips, can you grip my fingers as tight as you can? Very good. Okay, so your strength is bilaterally symmetrical. And for my arms, grab my wrist, and I'm going to give some resistance, and you just push and pull. Very good. So your strength is bilaterally symmetrical as well. And then, okay, I think I hit there, there. And now going on to neuro. Can you do this for rapid motion? Very good. You touch each finger to your thumb. Good. It's okay. And then can you stand up? I'm going to inspect your spine. Okay, so go this way and bend over. Checking if your spine is midline. Okay. Very good. Your spine is midline. And then you can stand back up. Okay. And now I'm going to be checking your gait. So can you walk down and back? So you have smooth open gait and your arms swing by your side smoothly, which is very good. Now I'm going to be looking at your skin. You're white and you're fair. The moisture, you are relatively dry, and your temperature is bilaterally symmetrical on both sides. So your temperature is good right there. And then all throughout the assessment, I've been looking at your skin and seeing if you have any lesions, bumps, scars, anything throughout. And I have not noticed anything, so no lesions, bumps, scars, or anything different there, which is very good. And the last thing is, can I see your nails again? Just to see the pink, rounded, groomed, and they're not blue, so you're not cyanotic. Very good. Trying to think if I forgot anything. Let's see. I think I covered most of it. I think you're done. Thank you so much.
Okay.
Okay, so next I'm going to just listen to your carotid pulses in the 3 different spots that I was touching. Perfect. Okay, so now we're going to just check the range of motion in your neck and your head. So if you could turn your head to the left for me, going against my hand. Turn it to the side. And now to the other side. And then I'm going to have you push up on my hands. Or down on my hands. Push up on my hands. Oh. I'm going to have you push my hands up with your shoulders. And I'm going to push them down. Okay, now put your shoulders down. Perfect. Now I'm going to palpate your thyroid, so I'm going to have you turn your head to the side. Okay, and to the other side for me. Perfect. If you don't mind, could you remove your shirt? Okay, so I'm going to just do this real quick. Okay, perfect. So I'm going to just start at your front if you don't mind. And I'm going to just touch your skin. Tell me if you feel any pain or tenderness as I do this. Any pain or tenderness?
Nope.
No? Okay. I'm going to put my hands right here. If you could take a deep breath in and out. Perfect. Okay. So now I'm going to put my fingers in different spots. I'm going to have you say the word 99 for me.
99.
And again.
99. 99. 99. 99. 99. 99. 99.
If you don't mind lifting up your breasts for me.
99. 99. 99. 99.
Okay, perfect. Now I'm going to just put my fingers on your skin and I'm going to tap, okay? And if you could lift your breasts for me again. Okay, now I'm going to just listen to those areas. If you could just take a deep inhale and exhale every time you feel my stethoscope on you. lift up your breasts again. Okay, and you can put them down. Now I'm going to scoot to your back. And I'm going to do those same things. So if you could say 99 again.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, and I'm going to just touch your back again. Tell me if you feel any pain or tenderness anywhere. Anything?
Nope.
No? Okay, and then I'm going to tap again. And then I just listen to your back. Again, take a deep breath in and out every time you feel my stethoscope. Okay, perfect. So your lungs sounding clear. That's good. Okay, so I'm going to touch your kidneys. Tell me if you feel any pain over here. Any pain?
No.
Okay. Okay. So I'm going to take a look at your arms. Just going to make sure that they're the same temperature. They are. I'm going to feel your joints. If you could lift your arm. Okay, you can put it back down. You could bend your elbow, straighten it. Feel your wrist. I'm going to feel down your fingers. I'm going to do the same thing on the other side. If you could lift, down, bend, straighten. Do you feel any pain while I'm doing this?
No.
Okay. Okay. I'm going to take a peek at your hands. I'm going to inspect your nail beds. I'm going to press on all of your fingernails just to make sure that I see capillary refill. Okay, I'm going to do the same thing with this hand. Perfect. Now I'm going to pull your skin. We're just going to see if it comes back right away. We're just making sure that you're hydrated. I do the same thing in the other hand. Okay, I'm going to see your wrist. I'm going to touch your wrist over here again. Just checking your pulse in both of your wrists. And it's fairly strong, so I would rate it about a +2. If I could see your arm again, I'm going to feel for another node. If you could pretend like you're shaking my hand. Okay, and if you could make a fist or a muscle. Perfect. I want to do that in the other arm as well. Okay, and if you could make a muscle again. Perfect. So now we're going to check your range of motion. Could you push up against my arm? And back down. Can you straighten your arm? And bend it. Can you put your wrist upwards? And back down. Okay, and we're going to do the same thing in the other arm. So out, out, oh, and in, down, and up, down, and up. Perfect. So you're a little young, but eventually you're gonna have to start doing self-breast exams. So once a month, about 4 to 10 days after your period, you can do it in the shower, in a mirror, or while you're lying down. You're gonna start at the armpit, and you're gonna go around in a circle towards your nipple. And you're gonna do that at different pressures, okay?
Okay.
Do you have any questions?
No.
No? Okay. So if I could have you lay down for me now. Okay. And I'm gonna just touch across your chest. Okay. Do you feel any pain?
No.
Any tenderness?
No.
No? Okay. Could I have you lift your bra a little bit? I'm going to just look for your apical impulse, and that's going to be by the 5th intercostal. Okay, and I feel it right here. I'm going to rate it about a +1 because it is fairly weak. I'm going to listen to your chest now. So I'm going to start right here. Okay, I'm going to do that one more time. Okay, now I'm going to listen to this pulse for a minute. Okay, and for that I got 62, and that's normal. So next I'm going to have you roll to the left side, please. Yes.
Okay.
And I'm going to listen to those 5 spots again. If you could move your arm. Okay, and I was just listening for any abnormal noises, and I didn't hear any. Okay, I'm sorry. Okay, so I'm going to now listen to your stomach. So if you could lay that down. I'm going to just listen to the 4 quadrants. Listen for any bowel sounds. Okay, and then I'm going to just listen to your aortic vein and your hepatic. Okay, perfect. And now I'm going to just percuss the 4 quadrants, and I'm going to listen for your liver and your spleen. Okay, I'm going to measure how far I see your liver in centimeters, or how far I hear your liver in centimeters. And it's about 7 centimeters, which is normal for a woman. So I'm going to just keep percussing your stomach. And I'm also going to feel for your spleen. Okay. So now I'm going to slightly press down and tell me if you feel any pain. Any pain while I do that?
No.
Do you mind if I press deeper?
No.
You don't mind?
No fine.
Okay. And this is just to look for any enlarged organs. I don't feel any. I'm going to feel for your liver. So if you could take a deep breath in. Okay, and I'm going to do the same. You can take a breath out. I'm going to look for your spleen. If you could take another deep breath in. And out. Okay, so now I'm going to palpate your arteries in your femoral artery. Do you mind if I pull down your waistband a little bit?
No.
Okay, I'm going to do it on the other side as well. And they're very weak, so I'm going to rate those a +1. I would also be looking for inguinal nodes. Those are located near the groin in the femoral triangle, but I'm not going to do that. You can sit up now, please. Perfect. I'm going to just take a peek at your legs. I'm going to make sure that the temperature is all the same. And your body feels warm. I'm going to feel a couple of different places. I'm going to feel behind your knee. Okay, I'm going to do it on this side as well. If you could bend it for me. Okay, and I would rate that pulse about a +1 because it is fairly weak. I'm going to feel by your ankles for this pulse. Okay, and this one as well. And that's also pretty weak, so I'm also going to rate that a +1. I'm also going to feel one on your foot. If you could lift your big toe for me. And this side. Okay, that's also a +1. I'm going to palpate, or I'm going to touch your legs, and I'm going to feel for any edema, which is swelling. And you have no swelling, so I would rate that as 0, as non-existent. I'm going to check between your toes. Okay. Perfect. And then I'm also going to push down on your toes like I did with your fingers. Okay, this foot. Okay, good. So now I'm going to feel the joints in your legs. So I'm going to start with your hip. I'm going to go down to your knee, your ankles, and your toes. And I'm also going to do that in the other side. Okay. Perfect. So now I'm going to check your range of motion. If you could lay down for me again. I'm going to have you lift your leg against my arm. And I'm going to have you put it up and push it back down. Okay, and in the other leg. And again. I'm going to have you lift your knee. And the other leg. And then if you could raise your foot against my hand. And push it down. Okay. And then I'm going to have you lift your foot on this side. And push it down. Okay, and then I can have you sit back up. Get your abdominal muscles, noticing you don't have any facial expressions. Okay, so I'm going to have you answer 5 questions for me. Okay. What is your name? What's the date?
May 5th, 2020.
Okay, where are we right now?
We're in my room.
Okay, what are we doing?
An exam thing.
Okay, and what is my name?
Gabby Tucholsky.
Okay, so now I'm going to be doing one test. I'm going to have you close your eyes. And I'm going to put a cotton ball against your face. Tell me when you feel it, okay?
Feel it.
And then I'm going to have you keep your eyes closed. I'm going to use an object that's sharp and that's dull. I'm going to have you tell me if it's sharp or dull. Sharp. Sharp. Dull. Sharp. And then I'm also going to do it in your feet. Sharp. Dull. Sharp. Sharp. Perfect. So next I'm going to have you close your eyes again, and I'm going to write a number in each hand, if you could tell me what those numbers are. 1. 8. Perfect. I'm now going to place an object in each finger, or in each hand. If you could close your eyes and tell me what that object is. Is it a ring? Yes. And then if you could tell me what this one is. It's a cotton swab. Yes. Okay, so now I'm going to have you close your eyes, and I'm either going to move your finger up, down, or keep it the same. If you could tell me which way I'm moving them. Up, down, same, up, same, down, down, up, same, down. Perfect. So now I'm going to test your brain function. I'm going to have you do cake on your lap just 3 times. Okay, and if you could touch your thumb to each one of your fingers. Okay, now if you could lay down, I'm going to have you straighten your leg, and I'm going to have you bring your heel down your shin. So your heel is going to go up. You got to bend your knee. And you're going to put it down your shin. Okay, and the same thing on the other side. Okay, and if you could stand up, I'm going to have you walk heel to toe. Okay, and then turn around and walk back. Perfect, you can sit back down then. We're going to quick check your reflexes. So I'm going to have you, I'm going to hold your arm. I'm going to want you to be fully relaxed. So let me hold all of your weight. Perfect. And we're going to do it in your wrist. Again, be fully relaxed. Perfect. I'm going to do that in the other arm. Okay, and then over here as well. Okay, I'm also going to do it in your legs. And this leg. Perfect. Okay, so I'm going to have you stand up and close your eyes for 20 seconds. I'm going to have you turn around. And I'm going to just feel your spine real quick. And then we're going to also test you can turn back around. We're going to test the range of motion in your back. So if you could bend down and touch your knees. Okay, you can stand back up. Can you turn from one side to the other? Perfect. Okay, you may take a seat again. Okay. So overall, everything seemed normal. You were able to perform all the tests with ease. All of your vitals seem normal as well. So